To the U.S. now, and the White House is imposing travel restrictions on Brazil. Starting May the 28th, foreign nationals will be banned from entering the U.S. if they've been in Brazil in the last 2 weeks. Brazil's number of coronavirus cases is now the world's second highest after the U.S. President Jair Bolsonaro has been opposing guidelines like social distancing that have been imposed in other countries to contain the virus.
He's rarely seen in a mask, and his supporters like it that way. Compared with most world leaders, Bolsonaro has not been taking the coronavirus pandemic as seriously as he takes the economy. And figures published by the country's health ministry show the results. Brazil has the second highest number of infections in the world. COVID-19 has killed nearly 23,000 people here. Yet, despite the mass graves and the funerals, Bolsonaro's staunchest supporters still don't believe the numbers. You don't have to study politics very much to know what this is about. I saw the news about Brazil today. I think it's the country with the second highest number of positive cases. That's certainly a lie. They want to overthrow our president by dividing us. They want to divide us. Bolsonaro has enjoyed huge political backing from his US counterpart Donald Trump. They last met in March.
He's doing a fantastic job, a great job. Brazil loves him, and the USA loves him.
But a week ago, even Trump was clear there's a problem.
I don't want people coming in here and affecting our people. I don't want people over there sick either. We're helping Brazil with ventilators. We're sending them ventilators, okay? They need ventilators. I'm sending them ventilators. We have so many thousands of them. We're sending them. We're sending a lot of people. No, Brazil is having some trouble. No question about it.
Bolsonaro himself has not responded to the travel ban. He's happily in tune with his supporters, defying attempts to contain the virus.
Let's take a look now at some other coronavirus developments. Japan is set to lift the coronavirus state of emergency in Tokyo and 4 other prefectures. The move will allow businesses to gradually resume activity. New Zealand plans to further loosen its coronavirus restrictions by increasing the maximum size of gatherings from 10 people to 100. South Korea has reported 16 new cases. Authorities are trying to stem transmissions with 2 million more children returning to school this week. And Chile's president has warned his country's health system is very close to the limit. As case numbers rise there, the country has just under 70,000 cases. And Spain has started the next phase of relaxing its coronavirus lockdown, with people being allowed to meet in groups in Madrid and Barcelona. The country's first beaches are also reopening. The pandemic has already cost millions of Spaniards their jobs, and that number is so high that welfare programs can't keep up with soaring demand for food aid. DW's Jan-Philipp Scholz visited one Spanish family now dependent on charity food.
2 months ago, Manuel Ramirez wouldn't have believed it if you told him he would be in this position. In mid-March, the father of 3 was still a substitute teacher. Then his life went into free fall. First, he lost his job, then his wife lost hers, then the family had to use the last of their savings. Now he has to get food from the Red Cross. Without this charity, his family wouldn't be able to get by.
All of a sudden, I stood there and went through a whole range of emotions. First fear, then helplessness, then desperation, then anger. When it started, I tried to fight my emotions, but then I had to let go and accept what I was going through.
In the small town of Estepona in southern Spain, there are about 980 families who depend on food handouts. The fact that you see no lines here is because the local charity has a telephone appointment system, says social worker Pilar Vázquez. They do this to reduce the danger of infection, but also so those in need don't have to suffer the embarrassment of being seen there.
Now, middle-class families have been hit. For 2 months, they've had no income. But they still have overhead costs, rent, mortgage, and of course, daily expenses on top of that.
At least Manuel Ramirez doesn't have to worry about paying rent. Right now, his family is staying at his parents-in-law's apartment. But they have already used up their entire savings, around 800 euros. When the crisis began, he and his wife Inma joined a community call to help the needy. They bought 2,000 masks and gloves to give to charity. Now they still have hundreds at home. In hindsight, he thinks this might have been a mistake, but back then they thought they could count on receiving emergency help from the government. They are entitled to a few months of disaster relief funds, but up until now, they have not seen 1 cent.
They are ruining entire families. Were it not for charities and the incredible helpfulness of normal people, then at some point we wouldn't have anything to eat.
The two of them have been keeping track of how often they have called the social welfare office, more than 350 times. Sometimes the lines are busy, sometimes they get a recording, and when somebody actually answers the phone, the social worker explains the delay in payment has been caused by their increased workload.
They say they'll contact me, either by telephone or email. If I haven't heard from them after a week, then I should try again.
It's always the same story.
They feel lucky they can give their children a hot meal every day using the ingredients given to them by the Red Cross. Their kids have long accepted the fact that right now they can't get any new toys or even have dessert. All Manuel and Inma Ramirez want is to work again, or at least get their emergency relief money.
Well, refugees in Germany have started setting up support networks during the pandemic. Shelters in the country have become centers of outbreaks, with people living at very close quarters, even, they say, with those who are infected. DW's Bastian Hartig investigated the situation in the state of Bavaria.
Samba is a regular at this textile store in Bad Tölz, a small town close to the Bavarian Alps. Samba is a migrant from Senegal. He comes here to choose the fabric for the face masks he makes together with fellow migrants and refugees. It's their contribution in an effort to keep the coronavirus at bay in the crowded refugee centers like the one where he lives.
In a room, you can have 4 people or 5 people in one room. They say that the corona can have in your body 14 days before it will soar. So you can have it and we are at the same place, we will not know. So then the whole place will get it. So we say this is the only way we can able to help them, to support them with the face masks.
Samba is a member of a group of activists who help migrants and refugees all over Bavaria. Amid the pandemic, the group's special focus is on those who are in accommodations that are under lockdown because of COVID-19. Until recently, Ebu, also from Senegal, was under quarantine in a center in the nearby city of Rosenheim. On the phone, he tells Samba that people there are afraid of contracting the virus, because those who are infected were under lockdown together with everyone else. We visit a migrant center in Rosenheim that was among the hardest hit by the pandemic. It's been under lockdown for some 6 weeks. The local public health authorities are here to tell the residents that although there are currently no new known cases, the quarantine won't be lifted for at least another few days. Some here are growing impatient. I haven't worked for a month. My boss calls every day and asks why I don't come in to work. I've told him we're under quarantine and I'm not allowed to go out. It wasn't until recently that those who had tested positive for the coronavirus were taken to a different facility for isolation along with their families, after a month of quarantine. Simon Neuchel is a volunteer helper at the refugee center. He can't understand why authorities didn't act sooner. I think what was really needed from the outset was a plan for what to do if more than 2 or 4 people are infected. How can we accommodate people so they can live reasonably? In the schools, we're now dividing the classrooms up in a different way. There's been a change with physical distancing. Tables are empty. The same is true in beer gardens. But here in the center, everything's the same as it used to be. Many of the residents share bathrooms. Almost all of them share kitchens. It's practically inevitable that people are constantly getting infected. A spokeswoman for the regional government in charge of this and other centers says it has put sufficient measures in place to keep the refugees and migrants safe. We've informed the residents and the workers about how infections are spread. We use pictograms and put out flyers in different languages that explain hygienic measures that residents must follow, physical distancing rules, etiquette on coughing and sneezing, and why regular hand washing is important. There's disinfectant available. We're supporting the residents as best we can.
Wir unterstützen die Bewohner bestmöglich, soweit es uns möglich ist.
At Samba's accommodation in Bartels, he and the other residents don't want to rely solely on the authorities. They say they've already made 26,000 face masks to distribute to other accommodations all over Bavaria. And they plan to keep going until their situation improves.